Merry Christmas, and welcome to NewsNight Akron for Christmas night 2009. I'm Jody Miller, and I'm glad you're with us this evening. We've given our regular panel of journalists the evening off so they could spend their holidays with their families, and that gives me the opportunity of talking one-on-one with a man whom I consider to be a true gift to our community. Just recently, Bill Considine celebrated a 30-year milestone as President and Chief Executive Officer of Akron Children's Hospital. We want to take this opportunity to talk with Bill about his career. He is now, as I understand, the longest-serving head of a children's hospital in the country. We want to talk about his career, the hospital's exponential growth under his tenure, and about an extraordinary gift that he and his wife, Becky, recently made to the hospital. Bill, thank you very much for being with us.
Well, Jody, it's great to be here, and happy holidays. Merry Christmas to you and all the viewing audience.
Thank you very much, and congratulations. 30 years. 30-year milestone. That's, is it safe to say that time flies when you're having fun?
Well, I would say that, and being part of the children's family over the last 30 years has been a wonderful journey. And when I reflect on it, it doesn't seem like 30 years. And I look forward to serving the community and the hospital for several years to come.
Well, we're glad to hear that, obviously. But I want to go back. I'm not sure everybody who's watching tonight knows that you are, in fact, an Akron native. Born and raised here in Akron?
I was born and raised here in Akron. Grew up principally in South Akron. Went to Lincoln Elementary School for kindergarten. Went to St. Mary's for grade school. Went to Hoban High School. Went to University of Akron. During those years, I peddled papers for the Beacon Journal. I worked at Atlantic Foundry. I mowed greens at Firestone Country Club. Participated in a lot of our community organizations over those years, Boy Scouts, Cub Scouts, and the like. So I'm a native Akronite and very, very proud of it.
Well, you went to the University of Akron, so I want to know how you went from the University of Akron, where you got a Bachelor of Arts degree, and then you went to Ohio State. How did you get into hospital administration?
Well, you know, that's a very interesting story, and it all started when I was at the university. In my senior year, I was president of student government while I was there, and I'd been nominated for a community award, and one of the judges on the panel was a Mr. Roger Sherman, who was the president of Akron Children's Hospital. And Roger asked if I'd be interested in going to lunch with him. So he took me to lunch at a Rotary meeting. And following that, he introduced me to some of the men on his staff, and one man in particular who had gone through master's training in hospital administration. And they posed the whole concept of hospital administration to me. And I followed up on that. Ended up applying to Ohio State for a master's degree in hospital administration, and went into the first class that Ohio State brought through for that study. And 40 years later, I reflect back on all that really coming about because Mr. Sherman took the initiative to ask me to lunch and talk about what my career interests were. And as fate would have it, who would have believed that after that meeting, 10 years later, I would be back in my hometown and moving into that position as he retired.
Yeah, ironically, you know, he was the one that you replaced, or you replaced him.
And Mr. Sherman had been the president of Akron Children's for 35 years. And he also started as a very young man. And for me to start there as his successor at the ripe age of 32, it was a storybook. It really was. And I don't know if there's many hospitals in the country that have had two CEOs over a tenure of 65 years. That's
an amazing record, absolutely.
And it says something, too, about the community. It says something about the mission of that organization. And I think that kind of leadership and continuity of leadership has helped us be very successful in what we do.
Well, talk to our viewers about Children's Hospital, the mission of the hospital, but also how did it start? You know, how it was founded in this community.
Well, the Children's Hospital story is a very compelling one, and there's so many life lessons in that. And every other Monday when I meet our new employees at employee orientation, I talk to them about the children's story. Because it started back in 1889, and it started because a group of volunteers that were associated with two churches were sitting around tables talking about the whole concept of service above self. And when they were looking at what they could do through service to help others, they were thinking about how they could make our community a better place. And it just so happened back in 1889, one of the issues here in this community that was one that was a compelling one is parents were taking their children with them to work in the downtown factories. And if you just can imagine what the environment was like in a downtown factory in 1889, the air quality was bad, noise levels, safety conditions, plus the children were potentially in danger, and productivity of the employees was compromised. So these folks said, what if we created a nursery for children that was available to the parents so they could bring their parents there instead of bringing the children there instead of going to work with the children. Daycare before its time. And they sought out with that idea. They actually found out another group had their idea. Instead of having a hissy fit about whose idea it was first, they joined forces. They said, okay, let's now find a place for that. They went and found that there was a home that was owned by Colonel Perkins. He wasn't living in that home. They knocked on his door. They said, could we use the ground floor of this house, this grand house? And he said yes. And in honor of that, they named the nursery after his granddaughter, and they called it the Mary Day Nursery. And they opened their doors. They were a huge success. They didn't have bylaws and things of that nature, but they had 3 promises they made to this community back in 1889, 1890. And the promises were, number 1, within the Mary Day Nursery, we were going to treat every child as if that child's our own. Number 2, we're going to treat everybody the way you want to be treated. And number 3, we're going to turn no child away for any reason. And back in the 1880s, 1890s, one of those reasons was race. And they did not want that to be a barrier to serving all children. Today, those 3 promises are still very much alive at Akron Children's Hospital. We strive to treat every child as if that child's our own. We try to treat everybody the way we want to be treated, and we turn no child away for any reason. And the big challenge today is the ability to pay. And our doors are still open to all children. And we're very proud of that. And as we reflect back on that very humble beginning and the fact that the children started as a 2-room nursery in downtown Akron and was serving all children, today we're in 78 locations. We saw nearly 600,000 children last year through all our programs, and those promises are still alive. I mean, it's just a wonderful story. It's a story of volunteerism. It's a story about caring for others. It's a story about goodwill within a community. When they needed some dollars in those days, they had ice cream socials, linen sales. It was fundraising again before its time. And it's wonderful being part of that kind of heritage, history, traditions. It just doesn't get any better than that.
Well, and you have obviously carried through on that very mission. I have some statistics I want to go over with you. Okay. When you first started, there were 900 employees at the hospital. There are now more than 4,000. Like you said, there was 1 location then. You have 78 locations now. You had a $30 million budget then and a $450 million budget now. You had 21,000 outpatient visits then and almost 250,000 outpatient visits now. That's tremendous, tremendous numbers that prove what you have done in your tenure. Talk to us for a minute about the culture of leadership that you have established at Children that would allow the hospital to grow in that kind of way.
Well, when you talk about our growth, one of the things I like to chat about are the things that really haven't changed at Children's. And because they haven't changed, that foundation has remained very strong that we can build on. And what hasn't changed at Children's is its mission of caring, its mission of being respectful of everyone that comes through our doors. The culture at Children's hasn't changed. It's always been a culture that's been family-centered. We define family-centered care today differently than maybe we did many years ago, but still the culture of caring for the family as well as the child is something that's very strong. And the other part of the culture at Children's is its culture of community. Children's has always been an organization that hasn't defined itself by its walls. It's defined itself by those that it has the privilege of serving. So when you come into that kind of organization, at least the way I looked at it from a leadership perspective, is number 1, I wanted to listen and learn. Because there was a number of life lessons, as I already shared with you, that you could learn from dealing with the families that you were privileged to serve. But then we wanted to also look at the needs of those communities that are throughout the region that we're part of. And as we looked at those needs and defined those needs, we started to invest more and more in the future of our children. And that investment in the future of our children has led us into more and more communities. It's allowed us to recruit more and more physicians and clinical staff to our team. And as we did that, our numbers continued to grow. And what's really driven the growth in our employees and our doctors is the service that we provide. And if you can continue to do that, you're on the right track. If you're building just to build buildings, if you're building just to be bigger, you're not going to be able to sustain that. But if there is that essence, that substance of that mission that's there, and being an advocate for kids, you're on the right path. And that's really been my philosophy, I guess, is to be a servant of those that are caring for those families, being a cheerleader, and being a strong voice and advocate for our children.
Well, and one of the things that you do is you don't just sit in your office and administer all of the programs and all of the activities of the hospital. You go out on the floor. You have personal meetings with new employees, so that helps in terms of the culture of leadership that we were talking about. But you also talked about your life lessons that you learn, and that only comes from being out on the floors and intermingling and talking with the families. Tell us about that.
Well, the meaningful nature of our work is getting to know the families and the children that are in our hospital or utilizing our many programs we have throughout the communities we're part of. And we've developed a saying at Children's Hospital that there's no time for a bad hair day. And the reason for that is because when you interact with a child that's facing a life-threatening disease, and you see their strength, you see their courage, you see their positive attitude, and oftentimes you'll see those children are more worried about how their parents are dealing with their illness. They're more worried about how their caregivers are dealing with this illness. They're trying to prepare them for some of the issues that child is facing. And when you witness that firsthand, I can guarantee you there's nothing that comes into my office that should be a problem or cause me any kind of anxiety. If anything, it should give me the energy to make sure that we're doing our very best to represent those children that are up on those floors. And I have so many stories I could share with you, Jody, of little girls and little boys that have impacted my life through conversation I've had with them and their parents, but even more importantly, through me witnessing how they deal with some of the illnesses that, again, come through our doors.
How do you not get burned out, though, when you see such pain and suffering with children?
Well, oftentimes, some of the connections that I see occur, I have a sun catcher in my office that was given to me by a mother of a child that died at our hospital. And the little girl, when she was fighting her cancer, one of the things that she did is she painted sun catchers, and she gave those to siblings, parents, aunts, uncles, caregivers. And it just so happened that she died before she finished a couple of sun catchers. Her mom keeps one of those sun catchers at home to remind her of her unfinished work of being this little girl's mom. The other sun catcher that was unfinished she gave to me. And I keep it in my office to remind me of the unfinished work of Children's Hospital in terms of serving other kids. Now, that little girl in body is dead, but her spirit, I can guarantee you, is alive. Her mother is very involved in Children's Hospital activities now because she wants to carry on that little girl's legacy. And when you see that type of activity taking place, and it's just not one family, I could give you dozens and dozens of these stories. And again, if I think I should be overwhelmed by stuff, I just look at this. And it's positive energy. We know when we're in environments where you're dealing with negative energy, it drains you, and you do get burned out. When you're in environments where you're really doing God's work, and you're seeing the gift that He's given us through these children, it's invigorating. And that's why some people say I look younger today than I did 30 years ago.
Well, I have to agree. You certainly don't look like you've been in any job for 30 years. When you look back over that 30 years, can you give us some highlights? What are you proudest of?
Well, I think the thing I'm most proud of is the focus we have on families. And the way that as the hospital has grown, we've also grown in how we engage families. We have a parent advisory committee now at Children's Hospital who is very engaged in all our policies that we develop at the hospital, any building program that we do, any renovation we do. We want to do it through the eyes of a child. We don't want to do it through the eyes of an architect or an administrator like me. And our families are involved in that. I'm very proud of that engagement with them. I'm very proud of what we've done in terms of the quality discussions that we have. Children's has always been known for quality. There were silos, though, in terms of how it was discussed. Nurses wanted to talk about it among nurses. Doctors wanted to talk about it among doctors. Parents would talk about it over here. We've broken down those silos. We have transparency around quality discussions. When something occurs at our place that shouldn't have occurred, we want to know about that. We want to learn from that so we don't make those same kind of errors or what in future care programs. So I'm very proud of that transparency and the sense that we are doing our very best always to be better. Children deserve our very best. And status quo is our worst enemy. And one of the things we've talked about for years is if you get too comfortable and start resting on your laurels, you're going in the wrong direction. So you always need to be looking at ways for continuous improvement. And that philosophy at our hospital is something that I'm enormously proud of.
But that's a philosophy that you seem to extend beyond the hospital walls, because your commitment to the community and your dedication to the community outside of Children's is extraordinary. Why do you think it's important to go beyond the hospital walls and to give back to the community here?
Well, when you look at the timeline of a child and you look at what goes on in a child's life on a day-to-day basis, if you're going to be true child advocates, you want to make sure that they're supported through their daily life. So that has taken us into schools. That has taken us into having conversations about what we can do to make our community a safer place. Some of the work I've done over the years relative to dealing with our gangs in the community has really been driven by us trying to keep children out of our emergency room. Our program's about never, never shake a baby. When we see what happens with a child that is shaken and has a spinal cord snap, we have to educate folks. And you can go do that through schools, churches, neighborhood groups. And we want to extend and do that. We want to be partners with entities, organizations, families that every day, every minute of every life of a child, we have some influence on that in a positive way. And that really drives a lot of what I do in terms of being involved with Summit Education Initiative, being involved with the scouting organizations, being involved with various church groups, being involved with, you know the list as well as I do. It's invigorating.
Well, I know that one of your passions is healthcare reform at a child's level. And you've spoken, and I've heard you speak in the past about what needs to be done on a national level. So talk to us a little bit about some ideas you have about how to impact that area of healthcare.
Well, healthcare reform is very important, and it is needed. I am disappointed in the current debate that we're having that children, the word children, is not heard very often. And from my perspective, there's an enormous opportunity for us to do some things relative to our children's health care in this country. If it was up to me, one of the focuses I would have right out of the box would be to put a program together just for children. And it's a definable population. Most children are very, very healthy. And because of that, the cost wouldn't be as enormous as what we're trying to do when we're addressing the entire population. There's no national health care program for children in this country. And I'm not talking about a single payer system. All of us will qualify for Medicare. That's not true for a child. A child is in a Medicaid program if their parents are on welfare. If their parents aren't on welfare, then the child has to go through a commercial program or an employer program, and consequently the worst insured population we have in this country are children. The care system for them is very fragmented. So I would try to simplify that and take the money that we're now spending in Medicaid on children, which is the #1 payer for child health care. I would move that into a separate program for kids. I would complement that with employer-based coverage that would be based on the risk factors with the dependent, not the risk factors relative to the adult, the parent of the child. And then I would also encourage the commercial payers to come to the table and have one standard of care for all children, regardless of what payer program they were in. And it could be done. It could be done. And I'm a little disappointed that that isn't a focus of our conversations, but I'm still suggesting it every time I get a chance.
Good, good. Now, I don't know if it was because of your milestone of 30 years, but you and Becky, your wife, recently announced an extraordinary gift to the hospital. Explain to us, please, what you have done.
Well, when Becky and I were talking about the 30-year celebration, one of the things that we had hoped is that it would just pass by and the focus would remain on the hospital.
Well, because you, as a leader, are so reticent about being in the spotlight. I mean, that is one of probably your best qualities, but go ahead.
And we talked about that whole situation. Yet, 30 years is something to celebrate in terms of what Children's stands for and what it means to so many. And then Beck and I said, what could we do as a couple to, again, bring that focus on the meaningful work that goes on at Children's? And in talking with Becky, too, when we were thinking about how we can make the most impact and touch not only the children here and now, but future generations of children, we started talking about the research component of our mission statement. So we chose to make a donation to a children's hospital, and the hospital, in recognition of that, has designated our Clinical Research Institute the Rebecca D. Considine Clinical Research Institute. And that's, it's overwhelming, it's humbling, but we're seeing our dollars go, and hopefully those dollars will touch a lot of lives of a lot of children for years to come.
Well, and again, I thank you on behalf of the community, and what you did not mention, because again, both you and Becky would probably cringe at this, but the donation you made was $1 million to start an endowment, and you hope to be able to raise another, what, $2 to $4 million to help the Institute, correct?
Yeah, our hope is to use the $1 million donation that we've made and leverage that to bring another $4 million to the table on the short term and even more on the long term.
Bill, what lies ahead for Akron Children's Hospital and for you?
Well, Akron Children's Hospital is really a jewel, and one of the goals that we have is to shine that jewel so it continues to shine brighter and brighter and brighter. And as that light shines brighter, it does reach more and more children throughout the region. And we have a strategic plan of reaching out to more and more communities. As you heard, we're in 78 locations. We're going to be in more by the end of 2010. We have children come to us from almost every county in Ohio. We have children that come to us from 37 states and 13 countries. And to make sure that we're doing the very best we can do, we need to stay up on recruitment of clinicians, both clinicians that are going to replace those that are retiring, as well as new doctors. We have a new neuroscience center that we're going to be launching in 2010. We've made a major investment into plastic and reconstructive surgery that we're going to even launch on a larger scale next year with a pediatric fellowship trained plastic surgeon, the first in this community. We're making a major investment in ear, nose, and throat procedures and a center around that relative to a specialist arena for kids to be referred to. We're seeing our burn center continuing to grow. Our neonatal unit continues to grow. We need to replace our emergency room. It is gone far past capacity and needs to be modernized. Our neonatal unit needs to be modernized. So the capital plan is there, and they're going to keep me busy. They're going to keep me busy.
So you are planning to hang around for a little while yet?
Well, we are talking with the board. You know, I am 62 years old now, but I feel like I'm much younger than that. The energy level's high, but we need to be responsible in terms of a leadership role, have a conversation about succession. And we do have succession planning scenarios that we have talked through with our leadership. And one of my responsibilities is to set the table so when I do retire and move on, that it will be a non-event. The torch will pass. It'll burn brighter with the next individual that picks it up. And quite honestly, that'll make me the most proud if that kind of transition does occur.
Well, Bill, you are obviously a shining light in the greater Akron community. And what we want to do is just wish you and Becky the very best. Becky also is so much a part of this story. And she's been, we need to say, she's been a volunteer at the hospital for almost as long as you have been involved too. So it's kind of a family of Considines that have been involved with the family at Children's Hospital. So thank you very much. We appreciate very much the fact that you have joined us. We want to wish you and your family the merriest Christmases and happy holidays. And to our viewers, thank you very much for being with us. Hope you enjoyed our program tonight. And from all of us at Western Reserve Public Media, we are very grateful that you make us part of your lives. And we hope very much that you have a wonderful New Year. Thank you for joining us. Good night.